American Back Centers. You've got nothing to lose but the pain.
The following program, BackTalk, is sponsored by American Back Center.
At American Back Centers, you've got nothing to lose but the pain.
Welcome to BackTalk with Dr. Peter Pedduzi, located at 103 Bradford Road, Building 2, Suite 100 in Wexford. Now, with BackTalk, here is Dr. Peter Pedduzi.
Good morning, everyone. This is Dr. Peter Pedduzi with another episode of BackTalk. I'd like to start off each and every week. I'd like to say hello to all our loyal listeners. Thank you for listening. And a special hello to anyone who is new to the show. Of course, thank you for listening to the show if you are new to the show. Typically, in the first half hour of the show, we talk about the very unique and wide variety of treatment options we offer here at the American Back Centers, including the VAC-C therapy. Of course, a little bit of history as I talk about each and every week. On this show, Dr. Dennis Miskovich started the American Back Centers over 40 years ago. We've been in almost the same location. The location we were in originally is now an Ace Hardware building. He sold that building. We moved less than a mile down the street. Now we're across from Ditka's restaurant. It used to be Atria's. Now it's Ditka's. It's unbelievable how this area is changing out here. It keeps growing by leaps and bounds. And just in a span of 14 years, since I started with Dr. Miskovich 14 years ago, it's amazing how things have changed out here. But in the last 20 years, Dr. Miskovich saw the groundbreaking research that was done by Drs. Ramos and Martin, two neurosurgeons. This was published in the Journal of Neurosurgery, which I talk about on this show each and every week, showing for the first time that a non-invasive, non-surgical medical device could have the potential to create negative pressure. This negative pressure is essential to pull a herniated disc, a bulging disc, back into place. Also able to help people with herniated disc problems, sciatica, stenosis, failed back surgery. In many cases, a lot of patients are not even aware that they have a disc problem. They may have back pain. Their back pain may be misdiagnosed. They may not have an MRI showing a disc problem. And really the only way you're going to know if you have a disc problem is by having an MRI. The MRI shows the soft tissue as opposed to an X-ray just showing bone. So it is essential in some cases that we do order an MRI to confirm your diagnosis. So again, if you are new to the show, welcome to BackTalk. In the second half hour of the show, we typically talk about a nutrition or fitness-related topic. The last couple of weeks, we've been talking about the 2016 tips that Dr. McCullough from McCullough.com has compiled from last year's health articles. We talked about some of the key points that he talked about last year in a paper that you can actually download from our Facebook page or by going to McCullough.com, MERCOLA.com. Go right to his webpage. Action plan. Actually, no, I'm sorry. The 20 top health tips from 2016. And we touched on that last week. This week, we're going to be touching on the action plan for 2017 and the rest of your life. So we're going to be talking on some of the things that he wants to remind you, and we want to remind you of healthy lifestyle strategies to implement as you're setting your New Year's resolutions, or you've already done it, or you should have, goals for 2017. So we'll touch on that in the second half hour of the show. If you'd like a copy of either health article, of course, you can go to McCullough.com, or you can go to my Facebook page, which we're trying to download the articles each and every week if we have time on the Facebook page prior to going on BackTalk, our show, each week. You can go to American Back Centers Pittsburgh. American Back Centers Pittsburgh. Find our Facebook page. If you have a second, we would appreciate that you like our Facebook page. Go on there and like that. Just click on the thumb up button there and like our page, and you can also download any of the articles we have on there on the Facebook page. Again, American Back Centers Pittsburgh. Go ahead and check that out, and you can download those articles free of charge. If you don't have a computer, of course, as I touch on each and every week, we try to help you out so we can send out the articles to you free of charge. You just have to call us, give us your name and address, and again, we'll be more than happy to send those out to you free of charge. All right, as we talk about each and every week, of course, the American Back Centers, we are not your typical chiropractic office. Since 1994, the American Back Centers, as we touched on, has specialized in the treatment of very difficult disc-related conditions, including herniated disc, bulging disc, sciatica, stenosis, degenerative disc disease, and other serious health-related issues. We've had patients come from every doctor known to man in some cases. Of course, we don't prefer that. We would prefer if you come to us in the earlier stages. Of course, your prognosis is much, much better in the earlier stages of your condition, but we've seen some of the worst cases here at the American Back Centers just in my 14 years here, as well as the 20 years that we've been treating these very difficult disc-related conditions. With that 20 years of experience, as you see, we're one of the most experienced facilities in the country instituting this type of care. Of course, we have the best treatment option called VaxD. That's known worldwide now as the foremost treatment for these type of problems. There's approximately 3,000 patients a day being treated with VaxD therapy, and approximately 300 facilities worldwide instituting this type of care. We see medical doctors, orthopedic surgeons, there's some hospitals that institute VaxD therapy, chiropractic physicians, as well as physical therapists, all accepting and using this wonderfully researched procedure called VaxD in their offices. So it's very important to note. A lot of people are confused because they see a lot of these glorified, quote, decompression devices. You may hear something advertised on the TV or radio stating that they have the latest and newest disc treatment. They call it by many names neutrodiscmosis. They have decompression therapy. In most cases, if not all cases, if you look closely and actually ask the doctor or the facility, what are you doing? Number one, some of the facilities won't even tell you what they're doing, so that should put up a red flag to me, as well as you. If they're not going to tell you, they're trying to hide what they're doing. And in most cases, if not all, they're actually doing a glorified traction device, and we all know traction has never been approved by the FDA for these type of problems, and VaxD has. VaxD has been approved since 1994 by the FDA for disc herniations, bulges, extrusions, sciatica, stenosis, and even failed back surgery. That's very, very important to note. And again, we're one of the first facilities to institute it because Dr. Miskovich purchased 2 VaxD tables back in 1994 when he saw that groundbreaking research that was done and published in the Journal of Neurosurgery by 2 neurosurgeons, showing that each and every time you undergo VaxD therapy, they actually put pressure transducers into real-life subjects receiving VaxD therapy. Each and every time your pressure is reduced to negative levels, upwards of a negative 160 millimeters of mercury. That's how you measure pressure or negative pressure in the case of the VaxD therapy within the disc. So we're actually reducing the pressure within your spinal canal and in your disc, reducing the pressure within the disc, I should say, allowing for a vacuum effect to occur, negative pressure, pulling and retracting that disc material back into place, reducing the inflammation, even more importantly, allowing that compressed disc. And really that's the cause of the problem in most cases, leading to your sciatica, your stenosis, your pain down your leg, your numbness, your tingling, your weakness, allowing fluid and nutrients back into that compressed, degenerated, desiccated disc. And that's very important to note because if you don't address that, if you just take pain meds, if you just get epidurals, in many cases surgery, all they're doing is snipping off a piece of the disc, discectomy, take a piece of bone, laminectomy. The laser, same thing. All they're doing is using a laser, and we talk about this each and every week, instead of a scalpel. Most surgeons will tell you that they prefer not to use a laser because it's not as precise. They don't know how deep they're penetrating. It's not as predictable. But they tout this laser procedure as safer, more effective, less problems, but they still have to rip out ligament, bone, and tissue before that laser even goes in. So again, direct quote from a surgeon, the Laser Manifesto paper that I've touched on this show many, many times, states, what therapeutic benefit does that laser even have at that point after you cause permanent damage by ripping out ligament, bone, and tissue? Let alone the fact that the laser is just snipping off a piece of the disc that's bulged, herniated, not really addressing, again, the compression, the true cause of the problem, the cause of your degenerative disc disease, your bulging, your herniated disc, leading to your stenosis, that disc pushing out into the canal, narrowing that canal, spinal stenosis, foraminal stenosis. in the case of the holes, the foramen, in which the nerves come out of, being narrowed, pushing on those nerves, causing sciatic pain. Those are the causes of the problem in most cases. And we address the true cause of the problem by distracting, opening up that disc space, creating that negative pressure, allowing for the retraction of the disc material off the nerve, out of the canal, relieving your sciatica, your stenosis, your pain, your suffering. And you can see how surgery doesn't do that. And there's a lot of possible permanent complications with surgery, scar tissue infection, bleeding, that occur very readily with these permanent procedures, surgery, with possible permanent complications. And you see the lack of success, whether it's a laser procedure. On top of that, the laser procedure, $20,000 to $30,000, $40,000 out-of-pocket expense. And you're no better off, even though they claim that you're so much better off, this crazy 98% success rate. Where are they getting this at? If you actually look at it, you look closely, the 98% of the people that do well may have relief for a period of 6 months to a year, if that. Then the pain comes back because, again, they're not addressing the true cause, the compression. The bone spurs, the arthritis still continues to develop. That compression on the disc returns, not including the surgically altered site, now affecting the areas above and below. You see that commonly with a spinal fusion, where they put the rods and screws in. That takes care of the compression, finally, but very invasive, putting screws and rods in. Very invasive surgery, last resort surgery. And then the areas above and below have to compensate for that fixed fused segment that used to move. Now it's not moving. Kind of like, as I always mention to you on this show, kind of like taking a link out of a chain. Take that link out of a chain, the rest of the chain suffers. And that's why surgery is not effective, and that's not including all the other things we see. Blood clots, infection, scar tissue. We touched on this show many times. Dwight White, famous steel curtain. 5th back surgery, died of a blood clot. It happens every day. But they continue to do these procedures because they are money-making procedures. The hardware, the procedure itself, the pre-op, the post-op, all of that is a money-making procedure for the hospitals and facilities doing them, let alone the epidurals that they do for just about anything now. Pain injections. Somebody goes into their PCP. They have a shoulder problem. Well, we're going to inject the shoulder with steroids. They're injecting everything because in many cases they don't know what to do for the patient. And they think an injection is going to hopefully reduce the pain. But in most cases it does reduce the pain, but for a very short period of time, but again, not addressing the true cause of the problem. We touched on epidurals and research studies showing no major difference long-term with disc patients than compared to a placebo. No different. Maybe temporary relief, but not solving the problem, nothing like Vaxi does, actually addressing the structural cause of the problem. So again, we see 3,000 patients a day, 300 facilities worldwide instituting this type of care. We are lucky to be the facility in this area that institutes this type of care. We've been doing it for over 20 years. So again, one of the most experienced facilities in the country instituting this type of care. And again, our protocol continues to get better. Of course, our protocol is physician-directed. Our protocol engages other modalities as needed on a case-by-case basis. We screen out and decline candidates whose medical records and evaluation indicate we're unlikely to help them. So if we cannot help you, we would refer you out to the appropriate surgeon or specialist that we feel would help you. We have over 20 years of experience instituting this type of care again. So, again, we know what we're doing. We've seen thousands of cases come through our door. If we feel that you're not a candidate, of course, we will refer you out to the appropriate specialist. And, again, our success rate is extremely high because we're very, very picky on who we accept as our patients because we want you to do well. We want to make sure that you do well and you're very successful with your treatment. So, again, our treatment protocols are extremely effective, and we see great, great results with what we do here because we continue to perfect our protocols. And, again, we've been doing it for a long time as well. So if you're out there listening and you have back pain, neck pain, unresponsive to your current treatment, you want to avoid further pain medication, epidurals, physical therapy not working for you. We talk about physical therapy. I do physical therapy right here at this office. And physical therapy is extremely important. But the problem with it is if you're doing therapy to address a disc problem, especially if it's pretty severe, inflamed, in many cases you can actually make it worse because you're not really addressing the disc itself. You're actually addressing the surrounding muscles, which is very important. But first, in many cases, if the disc problem is not responding to your current care, as we talked about, whether it's chiropractic, physical therapy, pain medication, then you really need to take a look closely at what's causing the problem. In most cases, it's the compression on the disc. And until you relieve that compression or counteract what's the cause of the problem, you're going to be fighting an uphill battle. In many cases, I've seen the physical therapy, even chiropractic adjustment in some cases. Now, in many cases, chiropractic adjustments are going to help dramatically with disc problems. But in some cases, we get many referrals from other doctors, chiropractors, physical therapists, because they've hit a brick wall. Now their patient is not getting better. Their condition may be getting worse, and they come to us seeking a treatment specifically for the disc, FDA approved for disc problems, and that's where VAX-D comes in. We treat the patient with VAX-D, get things under control. We have protocols to really protect the patient. We restrict their activities. We restrict what they do. Initially, we require that they wear a back brace to promote that lordotic curvature, minimizing the weight bearing on those discs. And as they heal, then we incorporate the therapy into the program. We have 3 different levels of rehab with our VAX-D. We have rehab programs for all of our patients that come into our office. We treat all type of musculoskeletal issues, shoulder, back, knee. Of course, with the VAX-D, there's a specific program. And with that program, we put you through the program slowly as your disc is healing, and we look at you very closely to see how you respond to that new addition of therapy, rehab. In some cases, if you're not ready, then we back off. But then when you're completing the program, or almost at completion of the program, you're doing aggressive core strengthening exercises to build up your core strength to protect your back. And you continue doing those for the rest of your life on your own, at home, to continue to keep your natural back brace, per se, strong. Because we don't want you to be dependent on an artificial back brace for the rest of your life. So, of course, we wean you off that at the appropriate time and institute the active rehab at the appropriate time, but not too soon, because, again, the rehab is not addressing the disc itself. You have to get the disc under control. Treat the disc as a primary issue first. Get the disc under control first. Stabilize the area, and then slowly incorporate the strengthening of the core and the muscles at a later time. And then as you follow this program, our success rate is extremely high because we're very patient with the process. We get the patient through the program, and they're pain-free, fully functional, working again, and doing very well, and never have to worry about the possible complications that can result with surgery, pain medication, epidurals, all these things that people do that they end up coming to our office wishing they would have come to us first. So, again, we can't help everybody, but, again, when you come in and schedule your free consultation, we can sit down with you. We encourage you to bring in your X-ray, your MRI, CT scans, anything that you have. Bring in your family member, spouse, neighbor, somebody with you to drive you out here in many cases, especially if you're in pain. Bring somebody with you. We'll go over your problem in detail and determine if we can help you. And again, we do book up very quickly, and we do try to get you in. Sometimes if you have an emergency, we'll try to get you in as soon as possible. If we have a cancellation or we have someone that had to change a date, sometimes we can get you in sooner than later. But, again, call us today to schedule your consultation because, again, we book up very, very quickly. All right, again, the VAX-D is the only FDA-approved, safe, clinically proven, non-surgical disc treatment out there. Again, developed for the management of disabling low back pain, radicular pain. Conditions include discs that are herniated, degenerated, posterior facet syndrome, degenerative joint disease or arthritis, sciatica, stenosis, even very effective with what we see many times every week, if not every day, unfortunately, failed back surgery conditions in people with multiple failed back surgeries. We see it every day. It's very, very discouraging to see these people come in with scar tissue, all these complications from these procedures that they thought would work, and in some cases it gave them some relief for maybe a couple months, maybe a year or so. Then the pain came back. Because, again, if you look at what they're doing, they're not really addressing the cause. And, again, you have a high rate of complication, possible complication with these procedures. The unique VAX-D treatment is protected by patents issued worldwide. This breakthrough technology was developed by Dr. Alan Dyer, the former Deputy Minister of Health of Canada. He was a PhD medical doctor who saw the lack of success even back then with surgery. He had a disc problem himself, so he developed this VAX-D treatment with the combined efforts of physicians, engineers, and technicians at major hospitals. He also, as I've talked about on the show many times, he also played a part in the invention of the heart defibrillator as well. We all know a very important invention. And, of course, Dr. Dyer was the sole inventor of the VAX-D treatment table. So we are doctors dedicated to bringing you long-term relief and avoiding the need for surgery now as well as into the future. Don't wait until your condition worsens. Call us today. Our toll-free number is 1-888-222-8293. Again, 1-888-222-8293 or 724-935-3300, 724-935-3300. Also, our fax number, we do encourage you to fax over any reports. If you have an MRI, CT, X-ray report, you want to fax it over so we can take a look at it. Just put your name and phone number so we know who to call back on the top. And our fax number is 724-935-3321. That's 3321. 724-935-3321. It's very simple. Just remember where you had it done. Call that facility. Give them our fax number. In many cases, that's all you need to do to get that over to us. Make sure you put your name and phone number on top again so we can call you back and talk about it. Again, we have people coming from many, many hours away. We have people coming from all over the tri-state area. We've had people from Montana, Texas, all over the country because this treatment is unique and effective. And, again, they like our experience. Of course, we had Forrest Whitaker as a patient here 2 years ago, not for me, but for the VAX-D. He started VAX-D down in Georgia. He wanted to continue it when he was filming a movie here, Southpaw, 2 years ago. We've had many professional athletes as well. People see this treatment as a very safe, effective alternative to back surgery. And, again, it's backed by real science and real results. Again, we've been doing it for over 20 years. Can't stress that even more. Over 20 years we've been helping people, so you know it works. Also, visit our website, www.americanbackcenters.com. You can actually request an appointment right on the website. We'll get back to you as soon as we can, usually within 24 hours. If we have that available, we will tell you. If not, we'll try to get the closest available to accommodate you. If not, we'll call you back and work something out as far as with your schedule and our schedule to get you in as soon as possible. Again, www.americanbackcenters.com. Also, you can sign up for our daily health update newsletter by going to the webpage. You get free health tips and an inspirational quote sent to your email each and every day by signing up for the daily health update newsletter. You automatically get signed up for the monthly In Good Hands newsletter. This is a monthly newsletter. It's put out by some of the greatest health minds, doctors in the country that contribute to this. And it's put out once a month, and you automatically receive the free In Good Hands newsletter when you sign up for the daily health update newsletter. Again, free of charge. So just go to the website and do that today and sign up for that. Again, www.americanbackcenters.com. Also, visit our blog, www.drpeterpedduziblog.com. Information updated on fibromyalgia, low back pain, carpal tunnel. Many, many health topics are updated on that blog each and every week. So visit our blog again, www.drpeterpedduziblog.com. So again, definitely visit our website. You can learn more about what we do. All the different treatments, which we're going to be touching on here in a few moments, some of the patient testimonials, and some of the things some of the common questions you may have about VAX-D and some of the other treatments we offer here at the American Back Centers. Of course, if you have any questions at any time, you can always call our office, 935-3300 to schedule a free consultation or to ask any question you may have on your mind. So, of course, VAXI is a medical procedure. It's the only FDA-approved, safe, clinically proven just treatment out there. Again, used by MDs, DCs, orthopedic surgeons, physical therapists worldwide in over 300 facilities. Approximately 3,000 patients a day are currently being treated with VAXI therapy. We also offer cervical disc treatment options if you have a bulging herniated disc, if you have cervical radiculopathy, you have pain down your arms. Good example is somebody that has pain down their arms into their shoulder. It could be a shoulder issue. It could be a number of different issues. And when you come in for the consultation, we will examine you. We'll do orthopedic tests. We'll do a neurological evaluation. We'll do a history to determine if it's coming from your neck, if it's coming from your shoulder, what is the cause of the problem. Same thing with the lower back. Some people may be diagnosed with certain issues in their lower back. They could be misdiagnosed. And until you get a thorough exam and or an MRI or X-ray, you may not know for sure what's causing the problem. In some cases, you may have a hip issue. You may also have a disc issue on top of that. And the disc may be referring into the hip, causing hip pain and pelvic pain. So it's very important in many cases to get that MRI to be sure, if we do feel there's medical necessity for an MRI, to be sure what your problem, what the cause of the problem is, because in some cases you could be misdiagnosed. So we do have, if you have a disc problem in the neck region, if you've had failed neck surgery, if you're contemplating neck surgery, give us a call and get a second opinion. At least get a second opinion first before you blindly undergo the knife. So we talked about therapy and rehab. We do it right here at the American Back Centers with our VAXI patients, with most of our patients going through our program, whether it's a shoulder, back, neck, knee, any musculoskeletal issue we address, and we have individualized programs for therapy and rehab. Ergonomic, postural instruction. So we look at what you're doing at work, what you're doing at home. We look at the total picture to institute our therapy and rehab programs. People come in following a hip replacement, knee replacement. We can do the therapy. If you get a script from your PCP, from your orthopedic for rehab, we can do it right here, in many cases even more effectively than some of the PT offices, because we have everything they have here, plus we have massage therapists. We also have chiropractic care, and we also have specialized treatments, namely for the disc, for the neck, and the low back region. We treat wrist, hand, finger, foot, ankle, and knee problems. Examples including tendonitis, rotator cuff and carpal tunnel, frozen shoulder. Deep tissue massage. We have great massage therapists instituting deep tissue massage, myofascial, trigger point therapy, acupressure, reflexology, done by a licensed massage therapist. Comprehensive nutritional consultations. We have a great symptom survey that you fill out, again, based on the symptoms you may be experiencing in your life. So it's very individual. It's grouped to different body areas. And it's called a symptom survey. You can take it home and fill it out. You can do it here at the office. We can send it to you. If you'd like to try it, call our office. We'll send it to you free of charge. It's a symptom survey. It's a comprehensive nutritional consultation evaluation based on your symptoms. And we grade it, and then Standard Process, the company that does this, and again, Standard Process has been around since 1929, so they're very reputable. People know about them, and they know what they're doing, per se, and they have a great symptom survey to give you a comprehensive nutritional profile. So if you're not sure what you should be taking, give this a try, fill it out, and it's very, very effective and accurate on, again, based on your individual symptoms. Custom-made orthotics, computerized digital scanning. We talk about this all the time. You used to do the casting kit where you stuck your foot into the mold, but we're finding now that the digital scan is so much more accurate. There's no doctor or human error involved with casting the foot. You simply just put your foot on this digital scanner, 3D scanner, and it scans both feet one at a time, and you get a nice color printout of any possible issues related to bunions, heel spurs, plantar fasciitis, fallen arches, what can affect your hip, your pelvis, your knee, all the way up in some cases to your neck. And again, remember, you start from the ground up. So in many cases, we look at people's feet and we see there's problems that we've been missing in many cases all along, which gets at last, in some cases, 5 to 10% of the problem resolved. In some cases, it's the entire cause of the problem. But again, it's a free scan. If you'd like to try, you want to come in and try the digital scanning system for the feet, give us a call, 724-935-3300. In-house x-rays. We do x-rays right here in the office. We have a outside facility that does nerve conduction testing, NCV testing, ultrasound testing. Nerve conduction tests are great for possible nerve damage that can result from diabetes, carpal tunnel. You've had a surgery. They may have damaged a nerve. We can detect that with the nerve conduction test in the ultrasound testing. And we have a very convenient MRI facility. If you need an MRI or CT, right across the street from our office, North Pittsburgh Imaging. So if you need that, we can write you a prescription for an MRI or a CT, whatever you need, as long as you have medical necessity, and you can go right across the street literally and get that done. So it's very, very convenient. I'm also a certified personal trainer, so I can help you get back in the gym and do things correctly. I touch on this each and every week, how we get people out of pain and they go in the gym with good intentions. They try to lift too much. They do things incorrectly because they don't know what they're doing in some cases, and they're back at our office again for something, in my opinion, it's very stupid. They're trying to get healthy, and they hurt themselves in the gym. So we don't want that to happen, so I can help you with that. I'm a certified personal trainer as well as a doctor, and I can help you get back in the gym and do things correctly. All right, as we mentioned, we offer a free consultation at no cost or obligation, no matter what you're looking for, whether it's the VAX-D, the cervical disc treatment, the orthotics, even the LipoLite, which we haven't touched on yet today, any of the things, the physical therapy, the rehab, anything we do in our office, we have to do a consultation first, an evaluation, in many cases an examination, history, determine if you're a candidate for those type of therapies. The consultation is at no cost or obligation. Again, we encourage you, bring in any films that you have. If you don't have any, that's okay. But if you do, make sure you bring those in. Bring somebody with you if you can for the consultation. And be prepared to give me a lot of questions, because I'm hoping you'll have a lot of questions about your condition. We'll do a detailed history, physical exam, as well as neurological exam in some cases to determine if you're a candidate for these therapies. We also have a free DVD video. This is when Channel 11 WPXI did a medical breakthroughs report on VAX-D and American Back Centers. This was done about 10, 15 years ago. Even 10, 15 years ago, WPXI, Channel 11, heard about all and saw all the success we were having helping people with VAX-D therapy. This was broadcasted on Channel 11 News, and Dr. Rosen interviewed Dr. Miskovich at that time, so there's some key questions that Dr. Miskovich is answering on this video, and you can see the VAX-D in operation as well. So just call us, and we can send you this DVD free of charge. We also have a 24-page Keller booklet describing all the ins and outs of VAX-D and how it works. Of course, you can visit our website as well, www.americanbackcenters.com. But if you'd like the 24-page Keller booklet, call the office as well. Ask for the video and the booklet. And it's a great resource showing all the research on VAX-D, some of the ins and outs, as I mentioned, how it works, who it's helpful for, who it may not be helpful for, and showing all the ways that VAX-D can help a particular patient. So that's a 24-page Keller booklet, the free DVD, which we mentioned as well. We also have some research papers, and so much research has been done independently as well as by VAX-D on the VAX-D table, proving the effectiveness of the table and how it works. But we had some research that was done right here at the American Back Centers, and it actually was published in the Canadian Journal of Clinical Medicine, so we're very proud of this. This was done a few years ago, and we can send you out a copy of this article, which we're very proud of, on what we did here at VAX-D and published, again, in the Canadian Journal of Clinical Medicine. We also have the Knife in the Back article, which we touch on all the time, showing the failures of back surgery and why surgery is not the best approach for chronic back pain, specifically fusion surgery, and talks about how they continue to do these procedures because it's such a money-making procedure for hospitals and medical clinics, lumbar fusion. Rods and screws in the back. It makes you cringe even thinking about it, but they do it. And in many cases, if not all cases, it's a last resort procedure. And they fuse the one segment, like we said, taking a link out of a chain. The areas above and below have to compensate, not including all the permanent complications that can result from putting rods and screws in your back, scar tissue, infection, bleeding, all those things. But we see continued fusions now. So when you fuse one segment, the areas above and below have to compensate, and eventually, years later, if not a few years later, they have to go in and fuse another segment, another segment, another segment. And then they go in there with the morphine pumps and all these other things because the patient's not doing well. They end up, in many cases, disabled with many complications, and you have to ask why. And this article shows why, because the money off these procedures. We also have the blue workers' comp book and the yellow auto accident booklets as well. Workers' comp, so many people are taken advantage of by the insurance companies as well as the employer. So if you're hurt at work, get this blue book. It's free. It's done by an attorney. So it shows you your rights as an injured worker in the state of Pennsylvania. So if you know someone, even if you're not injured, if you know someone involved in a workers' comp case, call and get this blue. Ask for the blue booklet, free of charge. We also have the yellow auto accident. So someone involved in an auto accident, personal injury case, get that book for them as well. They're both free. Just call our number, 724-935-3300. Of course, we treat many workers' comp cases. We can help you, especially if you lifted something at work, you hurt yourself at work, give us a call, especially if you think it may be a disc problem. In many cases, they may have diagnosed you with a lumbar sprain strain, and that's what they do typically. And even so, you have pain in your butt or down your legs. And they don't want to do that MRI in some cases because once they get that diagnosis of disc, then that requires more time off work for you and more money for them. And that's just how it works, unfortunately. So if you're in that scenario and you're not doing well with your workers' comp, you've been going to the workers' comp panel doctors, they're not really helping you, give us a call. Come in for a consultation. We can take a look at things and see if you indeed have a disc problem. If you've had a car accident, whiplash case, you were hit in the back, whiplash motion, we treat those type of issues very well with our rehab and therapy. If you have a disc-related issue in the neck, of course, we have specialized treatments for the disc in the neck region, cervical radiculopathy, if you're having numbness down your hands, arms, shoulder region, those all may be coming from the neck region from a car accident. So we definitely can help you with that as well. Just give us our office a call, 724-935-3300, or toll-free 1-888-222-8293 to schedule your free consultation. All right. As we get into almost in the second half of the show, I'm going to go over a couple more things with you. As we touched on with VaxD, this is not a traction device. VaxD has been around. It's been proven to be unique. We touch on some of the issues on this show many, many times. Some of the leading physicians in orthopedic medicine, pain medicine, neurology, and other specialties in hundreds of clinics around the world currently use VaxD's patented technology. Many doctors choose VaxD over other devices because it employs the original patented technology from which non-surgical spinal decompression therapy was born. The definite reference textbook, The Practice of Minimally Invasive Techniques, published by the College of Physicians Publishing Division, has a board comprised of several world-renowned orthopedic surgeons. Chapter 35 of this book, used in medical schools, text focuses exclusively on VaxD. The summary concludes that, quote, VaxD should not be considered traction in the traditional sense, but as decompression. VaxD is the only, and this is coming from a medical textbook, VaxD is the only non-invasive treatment that has been proven to decompress the disc. With other traction devices, there's only been indirect proof. So it's very, very important to note this again, because there's a lot of people out there claiming to be the same as VaxD or claiming to do what VaxD does. And this medical textbook proves, again, what we're telling you, that only VaxD has the FDA approval, only VaxD should be considered as true decompression because it's the only device that's been proven to do this. We saw this way back in 1994 and still has not been replicated by anyone else, by Drs. Ramos Martin, showing for the first time that a medical device could produce negative pressure, forming a vacuum, pulling a disc material, fluid, and nutrients back into a degenerated disc, pulling herniated disc, bulging disc material, extruded disc material back off the nerve, relieving your sciatic pain, relieving your spinal stenosis, relieving your foot drop, restoring that strength to that foot, that leg that you do incur with these type of disc problems. I'm going to give you a quick testimonial from a patient. His name is Rob. He goes on to say, I lived with constant pain for 5 years due to 4 bulging discs in my lower back. After completing my 5th week on the BackTalk program, I have to say my results are tremendous. I literally have no back pain at all. Some days I don't feel like my low back. I don't even feel my lower back, which is amazing, because I would usually start off my day by stretching to get relief. For the first time in my life, I have good posture. And I have to make note of that. A lot of people ask me, did I get taller? Did they get taller? And they're not really getting taller. You may be getting millimeters of change in the height of your disc when you're getting vaccine, restoring fluid to the disc and restoring height. The main issue is, in most cases, you're probably antalgic. You're bent over, you're bent to the side, you're bent to the front, the back, compensating for your disc or nerve irritation. And now you're standing up tall with much better posture, so it makes you seem taller. He goes on to say, I don't even know what that was prior to this program. My idea of good posture was not even close to what I have now. I sleep finally through the night, and sometimes I wake, but I'm in the same position I was when I fell asleep, which means I'm not tossing and turning anymore because of the pain. I feel like this program has totally fixed my lower back. Now it's up to me to complete the program and strengthen my core to help support my spine. For the first time, I can honestly get out of bed without any pain to speak of. And this is from one of our many, many testimonials of patients receiving BackTalk therapy worldwide. All right, so as we talk about each and every week, the real question should be, why would you even think about surgery with all its complications and lack of success, not including the normal risks, including infection, bleeding, or even possible death from a blood clot, when vaccine is an option? Remember, vaccine is a non-invasive treatment with a much, much higher success rate than surgery, pain injections, or physical therapy. Many patients go this route and eventually end up at our office wishing they would have come to us much sooner or first. Remember, vaccine addresses the structural issues, not just the symptoms, decompressing the disc, restoring the fluid content, taking the compression off the spine of the disc, relieving pain associated with low back pain, disc problems, herniated, degenerated, extruded, bulge, sciatica, stenosis, or even failed back surgery cases. All right, so we're going to get into, before we get into the nutritional segment today, I want to highlight, as I do each and every week, some of the key supplements that we have here. We have a lot of different things here, but sometimes we like to highlight some of the more special supplements that I want to pass along to you, especially the esterified fatty acid complex. A lot of people are trying these joint replacement or these joint restoration products, glucosamine, chondroitin, hyaluronic acid, for their joints, their hip, their knee, even their disc. And if it's not working for you, especially glucosamine, there's great studies showing a comparison study, research study of EFAC, esterified fatty acid complex, compared to people taking glucosamine, and patients are seeing better results with the topical cream or the pills, which we offer. They comes in a soft gel or topical cream you can actually put right on the hip, right on the knee, wherever your problem may be. And the esterified fatty acid is something new. And if you're tired of wasting money on joint products that don't deliver and don't work, this may be something that works for you. And there's great research showing, again, a comparison between people taking the esterified fatty acids and the glucosamine or hyaluronic acid as well. If you'd like to try something different, even there's veterinarian doctors, as I talked about, seeing great success even with arthritic issues in animals. So if you'd like to try the esterified fatty acid, it comes in a capsule or in a topical cream. Call our office. We can send it to you, or you can pick it up right here at American Back Centers. Also, we have the all-in-one liquid multivitamin, which I touch on just about every week, called Intramax, and the Intra Kid for the kids under the age of 18. 100% carbon bound organic, nothing unnatural in this product. It's a liquid multivitamin. I highly recommend it because you're getting what you're paying for. You're absorbing it. You're not having to worry about taking a horse pill that may not even dissolve. You may only get maybe 10 to 20% of it. You're getting most, if not all, of this product because it's already dissolved and absorbed into the body with a high absorption rate, and again, 100% natural. Intramax or Intrakid. If you're looking for a great, effective multivitamin, the Intramax is the one that I take, the Intrakid for the kids. We also have the LipoLite, which I touched on. If you're looking for a safe way to slim, shape, and tone, if you want to lose a dress size or a shirt size, LipoLite triggers lipolysis in the fat cells, which causes the fatty acids to be broken down and released. Also stimulates fibroblasts, so it actually will strengthen and tighten your skin and tone your skin. So if you have stretch marks, little bags per se, and the love handles, the waist, you want to slim, shape, and tone, this product is extremely effective, and it works. And it's completely safe. After a series of 6 to 12 treatments, you will be amazed at the results. Again, if you want to lose a dress size, if you're a man, you want to lose a shirt size, try LipoLite. We offer it right here at the American Back Centers, a safe way to slim, shape, and tone. And again, if you'd like to try, call our office, and we can schedule you a consultation for the LipoLite procedure. All right, we're going to get into the nutritional segment today because we are getting later on time here. Last week we touched on the 20 health tips from 2016. If you'd like a copy of that article, visit our Facebook page, American Back Centers Pittsburgh, or Mercola.com, MERCOLA.com, and you can download it right from his page or our Facebook page. If you don't have a printer or a computer, I should say, we can send it out to you free of charge. Just give us your name and phone number, and we'll do that at no charge. All right, action plan for 2017 and the rest of your life. This is from McColl.com. 10 health strategies to implement for 2017. It goes on to state, are you ready to start fresh in 2017? Then read on. These 10 positive changes that follow are the creme de la creme of lifestyle changes that allow you to live a longer, healthier life, boosting your happiness and well-being all the while. Number one, you hear this one a lot, and we touched on this last week as we gave you a preview. Number one is give up soda. Obesity, diabetes, heart disease, kidney disease, liver damage, osteoporosis, and acid reflux are just some of the health conditions linked to sodium consumption. If you're drinking soda on a regular basis, committing to swapping to healthier beverages like water, sparkling water, occasional cup of tea, organic black coffee may be one of the most health-promoting decisions of your life. When you consume soda, your body increases dopamine production, which stimulates the pleasure centers of your brain. A physically identical response to that of heroin, by the way. This explains why you find it difficult to give up the daily soda fix. It can be done, though, and you'll feel better about it. If you struggle with soda or sugar addiction, try turbo tapping. Don't make the mistake of switching to diet sodas and other artificially sweetened drinks, which is actually worse. Research shows that this actually can make more problems. Of course, we talked about artificial sweeteners on the show many, many times. We know the dangers involved with that. Number two, eat an avocado every day. Avocados are a rich source of monounsaturated fat that your body can easily burn for energy. Avocados also provide close to 20 essential health-boosting nutrients, including potassium, vitamin E, and vitamin B. Avocados have a long list of potential health benefits, anti-inflammatory properties. Research suggests it can improve your lipid profile, protecting against liver damage, inhibit oral cancer cells. I personally have, Dr. McCool goes on to state, 2 avocados a day as they fit in perfectly with optimizing your mitochondrial health. Number 3, make fermented vegetables with family or friends. Fermented vegetables are potential chelators, detoxifiers, and contain a much higher level of beneficial bacteria than probiotic supplements. But, of course, if you don't have access to fermented vegetables, you can't do it. A probiotic supplement is better than nothing. In addition to cutting back on sugar and antibiotics, consuming fermented foods will give your gut health a complete overhaul, helping to clear out harmful microbes and promoting the spread of healing, nourishing microorganisms instead. Fermented foods may help with obesity, diabetes, preventing gut and bowel disorders, lower your risk for cancer, improve your mood and mental health, as well as preventing acne and reduce dental plaque, which can lead to cavities. Just a quarter to 1/2 cup of fermented vegetables per day can dramatically be a beneficial impact on your health. Number 4, donate blood and test your vitamin D and omega-3 levels. Donating blood while anemia is a concern for some. A far greater yet less recognized health hazard is iron overload. In fact, most adult men and non-menstruating women have damaging levels of iron that, if left untreated, can damage your organs and contribute to cancer, heart disease, diabetes, as well as other disorders. The serum ferritin levels measures your stored iron. I recommend adults get serum ferritin tests on an annual basis. Ideally, your serum ferritin should be somewhere between 20 to 80 nanograms per milliliter, but definitely no higher than 80. As a general rule, somewhere between 40 and 60 is a sweet spot for adult men and non-menstruating women. As we flip over here, he talks about vitamin D deficiency increases your risk of a wide variety of ailments and chronic diseases. A vitamin D test is what you're looking for. You should make sure you get that done. And obviously, sun exposure is the best way to do that. However, in the winter and indoor work, preventing people from getting ideal levels of vitamin D in sunlight. In that case, you may want to supplement with vitamin D3, not the synthetic vitamin D2. Increase your vitamin K2 levels as well, as we touch on this show. It's important if you have a supplement, like we have one here called Ultra K2 D3, has the D3 and the K2 together. So you're avoiding that calcium uptake and the calcium going into your arteries and clogging your arteries, which is something that a lot of people unknowingly do. Also, our L-arginine complete also has the vitamin D3 and K2 in balanced amounts as well. So make sure your supplement has that, the K2 with the D3 in balanced amounts. Also, omega-3 fats he touches on as well. Your body needs for digestion, muscle activity, blood clotting, visual acuity, memory, and much more. Omega-3 deficiency is thought to be an underlying factor in about 100,000 premature deaths each year. So it's important to make sure you're getting enough omega-3. Foods such as wild-caught Alaskan salmon, sardines, anchovies, and herring. If you can't get enough, make sure you're getting a good omega-3 supplement. Number 5, get more consistent and regular movement in your life. More than 10,000 published studies confirm that sitting is an independent risk factor for illness and premature death. In fact, inactivity causes mortality risk similar to that of smoking. So it's important to realize your body is designed for near continuous movement throughout the day. Setting a goal of 7,000 to 10,000 steps a day, which is just over 3 to 5 miles, can go a long way toward getting more movement and less sitting into your life. So basically, get up, get a drink of water, don't get fired, of course, walk around, make a coffee, don't sit in that chair all day, take steps, move around, get regular and consistent movement in your life. Number 6, eat more fish. Protein is essential for your health as it's a structural component of enzymes, cell receptors, molecules, and main building block for muscles and bones. That is said, eating excessive amounts of protein can actually be worse than eating too many carbs. So you want to be important that you're not doing that as well. Incorporating more omega-3 fish, we talked about Alaskan salmon, sardines, into your diet, making sure it's low in mercury and other pollutants, which can also be a problem as well. Number 7, as we skip down here, go with American grass-fed certified meat, beef, dairy, poultry, and pork. Make sure it's grass-fed and pasteurized in accordance with organic standards. Very important to note. Number 8, start peak fasting. We touched on peak fasting last week. Intermittent fasting is a term that covers an array of different meal timing strategies or schedules. As a general rule, it involves cutting calories in whole or in part, either a couple days a week, every other day, or even daily. The key is the cycling of the feasting, feeding, famine, fasting. By mimicking the eating habits of our ancestors who did not have access to food around the clock, you restore your body to a more natural state, which allows a whole host of biochemical benefits to occur. Peak fasting involves fasting for 13 to 18 hours each day, if you want to do it each day, and eating all your meals within the remaining window of 6 to 11 hours. To make the schedule work, you either skip breakfast or dinner. Which one to omit is up to you. However, if you choose to eat dinner, make sure you do it at least 3 hours before bed, because when you're sleeping, your body needs the least amount of energy. If you feed at a time when your energy is not needed, you end up creating a situation in which your mitochondria create excessive amounts of damaging free radicals. So make sure you're eating dinner. If you eat dinner, at least 3 hours before bedtime. Number 9, get 8 hours of sleep each night. Sleep problems have the same effect on your immune system as physical stress or illness, which explains why lack of sleep is tied to increased risk of numerous chronic diseases. So it's very important. Again, recent research reveals being exposed to even dim light during sleep can have an adverse effect on brain functioning as well as good sleep. If you're not sure how much sleep you're getting, a fitness tracker can be beneficial for helping you keep track of the actual time you're asleep as opposed to the time spent in bed. Also remember the 33 ways to good night's sleep. We touch on this show many times. Is also on Dr. McCullough's website, and we definitely can give you a copy of that if you don't have access to his website. Number 10, eat more fiber. High-fiber diet can reduce your risk of premature death from any cause, so definitely eating more fiber is a great recommendation. That's number 10. So that's your plan for life. Again, making New Year's resolutions fail, instead making a commitment to make healthier choices and live better this year. So we'll touch on this and summarize this again next week. We'll have a new health fitness topic for next week as well, so definitely stay tuned for that. All right, we are short on time. So as always, I'm going to leave you with some final closing thoughts. Why would you even consider surgery when vaccines available? Please be smart. Remember, surgery is a permanent procedure with possible permanent complications, including infection, bleeding, blood clots, scar tissue, and advanced degeneration. A smart, educated person who regularly listens to this radio station and show knows this and will usually make the right choice for their health. I want to thank everyone for listening. We'll be on next Wednesday and every Wednesday with another episode of BackTalk. This is Dr. Peter Pedduzi. Have a good week. Bye-bye.
You've been listening to BackTalk with Dr. Peter Pedduzi, sponsored by American Back Center, 103 Bradford Road, Building 2, Suite 100 in Wexford. For more information or to contact Dr. Pedduzi for an appointment, call 724-935-3300 or toll free 888-222-8293. That's 888-222-8293. And join us again for BackTalk with Dr. Peter Pedduzi.
At American Back Centers, you've got nothing to lose but the pain.